Beautiful, beautiful. This is a unique approach. This is Traverse Academy. This will be Cherry Creek's brand new day treatment facility. It was 2019, I floated the idea. Build our own, I didn't know if it would go. And at that time, I didn't realize it would be the first in the nation either. So that was a bit of a shock. And just saying that, this is important. And this can be a model, not only for the state of Colorado, but for the nation. And this can be part of the answer.
Because what's at stake?
Kids' lives. This facility will save kids' lives. There's nothing that says hospital, day treatment, mental health, or school about this. So every wing, they all have this large home base area. There'll probably be a maximum of about 10 kids at a time. Like this room is for group therapy. We also have these smaller rooms that are for individual therapy.
They also have light though, isn't that interesting?
It's that deinstitutionalization. It's bright, it's warm, and it should be welcoming. This would be our severe wing for kids who are in severe crises. That wing will provide more clinical intervention, not as much education, because the kids aren't ready for it. You'll notice the rounded walls.
There's no sharp corners, there's less places to hurt yourself.
It's safer. Normal day treatment facilities generally send kids back to school long before they're ready. What we wanted was a facility that met kids by where they're at in terms of their acuity. We want kids, when they come here, when they're ready, to be able to access really exciting educational opportunities so that they don't feel like they're missing out on anything by being here. These two classrooms are innovation classrooms. So we'll be able to do art projects, paint splatter area where kids can do splatter art. So we actually have a labyrinth. It's a walking path.
It's like a maze.
It is.
Yes.
Over in the other corner, we have an amphitheater outdoor classroom. We'll also have a boulder climbing feature. This facility is not meant to keep kids for an entire year. You really want to get kids in and hopefully a couple of months, get them stabilized and ready to go back to school to be with their peers and get back to their normal education. When they're ready, they'll step down into the moderate wing.
Which will be a little more education.
A little more
folded
education,
in.
little less therapy. We have a very unique transitional wing that looks a little bit more like a school. We'll work with kids there to get them ready to go back into their regular school. The crisis that's facing this country in adolescent mental health is not going to be fixed by separate solutions. Saying that we're school and we're just going to do school, that might have been acceptable 20 years ago. It's just not going to work. But breaking down those barriers and those silos is going to be massively important if we're going to solve this crisis.